First, Midori. Midori is, I think many of you know, is a distinguished visiting artist here at Peabody this year. This is the third visit you've had with us. She'll have another visit in April. Needs no introduction, of course, as a performer. She is also a distinguished professor of violin, holder of the Yasha Heifetz Chair at the University of Southern California, Thornton School of Music. She has, great interest, of course, in cultural diplomacy and the international impact of the arts. She's a messenger of peace, named a messenger of peace at the United Nations, and also founded Midori and Friends, which is, of course, an educationally based, community-based organization in New York. Kay Redfield Jamison. Dr. Kay Redfield Jamison is also, needs no introduction, professor of psychiatry at the Johns Hopkins School of Medicine, co-director of the Mood Disorders Center, enormously well-known author of a book, In a Quiet Mind, Memoir of Moods and Madness, named Time Magazine a Hero of Medicine. As I said, very, very distinguished. And we also have a very distinguished moderator for our panel this morning. Dr. Karen Schwartz, Associate Professor of Psychiatry and Behavioral Sciences at Johns Hopkins. She's the Clinical Director of Johns Hopkins Mood Disorders Center, which is, of course, our topic this morning. Director of Adolescent Depression Awareness Program and many other distinctions as well. So with that, we're going to get right to the panel. Ladies, you're on.
Okay, well, good morning. What I'm going to do is speak very little and let these distinguished women take the stage. What I thought we would do is just set the stage. Peabody is making a new effort, which is laudable, to bring information about depression and make it more aware, I think, to the students, particularly that this is a time of risk. People often ask me, why is it that going off to college, whatever that form is a time that people have their first mood episodes? Well, partly that's because that's the age at which people have their first mood episodes. So you take some biological vulnerability, mix it with some stress, maybe a little sleep deprivation. The students here can tell me, I'm sure you're all getting 8 hours of sleep every night. A little sleep deprivation and maybe a little more exposure to alcohol and drugs than you had at home. That mixed together is a time of real vulnerability. And both of these women who have mentored so many people and so many people at this age, I think, can share their experience of what happens when you have a talented person who's now facing a medical problem, sometimes for the first time. Most young people are pretty healthy, and so it might be the first time something serious happens. So with that context, I'm going to ask Dr. Jamison to start by just sharing some of her expertise about moods and creativity and how they are very strongly linked.
Right. I want to start by saying that there's a thin line between romanticizing very bad illnesses that are potentially lethal and suicide, very damaging to people's lives and devastating in terms of impact, particularly on young people who are trying to learn what they're going to learn in order to perform in the world and make friends and so forth. So the depression and bipolar illness, which is my specialty, are really potentially really devastating illnesses. I mean, the good thing about them is that they're really treatable illnesses. So it's important to know that from the onset. But there has been observed for thousands of years this kind of observation that people who are creative in the arts tend to be more vulnerable to intense moods and periods of occasional psychosis. And that was just an observation for a couple thousand years. And then in the late 1800s, people began to do biographical studies, and those biographical studies continued and continued until now, actually, looking at maybe 50 people who were musicians or 50 composers, 50 people who were poets or whatever, and looking at the rates of mood disorders in those people. Then the studies turned to looking at living artists and writers and taking groups of maybe 100 of those and doing systematic diagnostic interviews. So all of those findings were quite consistent, that there was an elevated rate of particularly bipolar illness, of depression with a bit of mania or severe mania. In the last 10 years, there have been 7 or 8 very large-scale studies. I mean, by large scale, it's ranging from 50,000 people to 1.4 million in terms of the sample sizes, of looking at very wide population rates and saying, okay, what's the rate of, are people who have been hospitalized for bipolar illness or schizophrenia or depression, are they more likely to be in creative fields, to be disproportionately represented in the arts, to be disproportionately represented in the very high ends of economic achievement, entrepreneurial business, and so forth? And the answer is yes. And it seems to be quite specifically bipolar illness. There are a lot of reasons for why this might be so, and complicated, but a lot of very obvious reasons as well as not so obvious reasons. It's important to note that most people who are creative do not have mood disorders, and most people who have mood disorders aren't creative. Okay, so that's just something you need. It's hard to keep these things in mind without sensationalizing it or so forth. But in fact, the science has been quite consistent in going in one direction. There are an increasing number of brain scanning studies of people when they're creating, and people genetic studies and so forth. So it's very exciting, and I think that that's one of the things that's very interesting about these disorders. But they are also very devastating, as Dr. Schwartz or anyone who's treated them would say.
And then I thought maybe you could give us the perspective of a faculty member and someone who's mentored so many people in this setting, in conservatories. If you think, just from that perspective, what's a little different, or what you see, or the way you see it impact when people develop mood disorders in the middle of their training.
Mm-hmm. I like to just start by saying that I'm very fortunate to be able to work with young musicians. They come from many different places and at different stages as well. And in my work also, bringing music to different groups of children, I work quite a bit with children with emotional disorders, with physical disabilities, as well as children who are in situations that have been rather, what we might say difficult. And so I also work with young musicians in training them to be able to go and bring music to children who are in such situations. Most recently, I was in Nepal, and I'd like to just share with you this story because I think it's something that I'd like to very much advocate for, which is that it's important. It's important as an artist to know that when treatment is necessary, go and seek it. And that actually it's not something that you need. Illness, and it's especially something as serious as unipolar depression or bipolar depression, schizophrenia, all these mental illnesses. Sometimes, we have in our culture a little bit that this is something we need to be creative. And I actually completely disagree, and this is why I want to tell you about this experience, most recent one, not the only one, but the most recent one that I had in Nepal, where I was actually spending 10 days in December, and I had brought with me 3 young musicians to do musical volunteering. So as many of you might know, that Nepal was struck by a major earthquake recently, about 1.5 years ago. And we were very fortunate, actually, as a group, to be able to go and visit some of these children whose villages were completely destroyed by the earthquake. And these children have been very, very traumatized for very obvious reasons. Their houses are gone, their schools are gone. They might have very likely lost friends, family members, people that they knew because of the earthquake and the aftermath of such a natural disaster. So this happened, after a few days of being in Nepal, working with children, bringing music to schools, working with children who are in what we might call very good schools versus schools in small villages. But then when we actually went to the epicenter of this earthquake, Gorkha, and visited some of these children whose lives are really so directly impacted by this earthquake, we noticed something very different. which was that children that we had seen earlier in our trip, they were so curious to see these 4 musicians, people with strange musical instruments that they've never seen, coming from faraway countries, one country that they may not even have heard of before. And here we were playing this thing called classical music by composers that they've never heard of, Mozart and Dvorak and so forth. And we were making weird sounds, so to say, loud, soft, and sometimes we were talking about the emotions in the music, or we were talking about the stories that the music was trying to convey. And they were very curious, and they responded with, laughter, and sometimes they thought that it was kind of weird, but, they were responding very well. And they were also able to show this and to demonstrate and to communicate what they were feeling and what they were taking in. Not all of them were positive, and not all of them were enamored by classical music, but they were, they had a response, and that they had a response to show and share with us. So when we actually went to the village where the children were directly affected, they saw us. They were curious enough, but the first feeling that I got from these children were that they were a little bit intimidated by us. They were scared of us, but then they didn't know exactly how to actually interact with us, and they had a rather difficult time demonstrating their responses to us. And we also played the music, and we tried to express, about how music can really touch our lives and how it can release our feelings and do all kinds of things. And the children, I think they were feeling it inside, but they had a very difficult time expressing it. And so in a way, trauma that actually caused these children to have difficulty expressing, this is something I relate to with musicians or any creators. When an illness strikes, a mental illness strikes, and it comes to such that it's basically a trauma, it disables the ability for that person to be able to express, to respond, or to demonstrate that response that one experiences inside. So if that happens, how do creators actually then communicate? Put this together. So the communicator is a person who is unable to express or to demonstrate the feelings. That's not going to really go together very well. We are here, we are trying to express ourselves as performers, as players, as musicians, as creators. And this is a point I'd like to make. Because there's so much stigma about not wanting to take care of or to acknowledge when one has a mental illness, particularly I find in the area of musicians, creators. I'd like you to think about the repercussions of when this is not being treated. So then it's the inability to be able to express. If you're unable to express, what do we do as musicians? So that's
wonderful.
Like to say.
And just to build on that, Dr. Jamison, I know that you have worked professionally with a number of writers and artists and musicians. What do I've exactly experienced that people lose their joy, they lose their creativity, they lose their ability to do what they do best when they're depressed, and so it gets in the way. What's your experience been when you've worked with creative people in all kinds of realms when they're in the middle of a mood episode?
Well, I think primarily, I suppose I've worked mostly with writers, but certainly with musicians. And it's a deep despair and about not being able to communicate, to create, because that's what one is. It's the essence of who you are. It's also, people forget that with depression, and one of the reasons why I think all of us go to the same age group to reach out and, depression hits the ability to think as well as the ability to feel. So you ruminate or you're slowed down, or it's not just that you have depressed thoughts, it's that you're incapable of thinking at the level at which you would like to be able to think and are used to thinking. And the intensity and the range of feelings, likewise, just becomes very stultified and very damaged. And I think that one of the things that happens with a lot of artists and writers is they come into your office and they make this assumption that if they're going to be treated, then something special is going to be taken away, you know, that creating element, that creating fire. And I think that what the job of a good clinician is to, A, know the facts, which is these are progressive illnesses. They get worse over time if they're not treated. They are very treatable, but so it's really important to get them treated or you're going to get worse. And nobody's creating when they're, you know, in 4-point restraints or in a hospital ward. But it's also true that, you know, people can participate in their treatment in a very active sort of way to sort of figure out what aspect of treatment is working best, to kind of moderate the medications, to figure out when their moods are most viable or most lively and so forth, when they're coming back to life, as it were. It's not this kind of, you're just tanked up on drugs over here and, you know, kind of ossified by medication, or you're over here some free spirit who actually feels like killing himself or does kill himself. I mean, so one of the things that we've taken it to a different realm of studies, one of the things we tell our medical students at Hopkins every year is, okay, a lot of you are going to get depressed, right? Depression's a really common illness, and you're right at the age of onset. This is not like a mondo bizarro disease. It hits a lot of people, and a lot of you are going to get depressed. And what we ask of you is we will do everything we can to treat you, and there's no reason to expect that you won't be treated and won't respond to treatment. But what we can't tolerate is doctors who aren't treated, because you need your intellect, you need your feelings, you need the ability to, as you say, express and receive expression. These are part and parcel of being a good doctor. So we try and make it very clear that we have a real investment in treatment, and treatment works. But if you don't get treated, I think, you know, as you say, you just sit there and you go further and further inward and don't express.
Well, and just to talk for a moment about the other side of bipolar disorder with mania, I remember a painter once saying to me, I'm very productive when I'm manic, but I can't edit. So everything I produce is not very good. I suspect there might be the same in music and writers and others, that there's a volume of production, but you know, you need your intellect and some other thought to really refine it to be something that's good. I don't know if either of you have had experience.
Well, I've just finished years working on a biography of the great American poet Robert Lowell, and he would, when he was hospitalized about 20 times for mania, and then always followed by very deep depression. But one of the things that he would be doing on the ward would be editing Milton or T.S. Eliot because he thought he was Milton, or because he thought he was Dante, or so forth. And he would say about T.S. Eliot, you know, The Wasteland, it just take out every other line, you know, because it was much better. But he, in fact, created a great deal when he was hospitalized, but most of it was terrible. And it was when he was depressed that he tended to edit it. But I don't think he responded very well to lithium. He finally got on lithium, and there was no way he was going back from treatment. I mean, you know, his life was devastated by this disease, but he did respond very well.
You had mentioned stigma.
Mm-hmm.
And you have a perspective that obviously, you know, I have a perspective about it, which is we're trying to fight it. But you have a perspective of being a prominent member of the musical community. What do you think it's particularly like for musicians?
Well, I think that there's definitely this idea that this creativity that comes from mania is something to be prized, for people want this in a way. And what I see with some of the students that I've worked with in these situations is that their work gets very disorganized, and they think it's almost like they're on this super caffeine high, and they're just going physically almost, and like you said, creating. Most of it was not very good. It just gets really hyper, and it starts to go around in circles, and they're physically spending the time playing the instrument without getting the work done. So, you know, they get this almost feeling that they're doing more work, but that, you know, also that they can't decide what's more, you know, important or less important, or how to prioritize. And it's just really like a big block of just you know, taking care of frantic, you know, series of things. And the playing also gets disorganized, I find. Everything is just, from the beginning to the end, almost too much, so to say. And actually, in the end, for the listener, it's not the most attractive, I would say.
Right. I've heard some artists describe me of different creative bents that they think perhaps if they're depressed, and this is something I argue against strongly, that if they're depressed, that out of that pain, that they're going to have more creativity. I mean, it just seems like pain and suffering to me, but, you know, thoughts that either of you have about that idea, where you really, as you said, Dr. Jamison, to start, you're romanticizing, you know, sort of because I'm a suffering artist, I can create more, I'll have more to offer. I don't know if you have thoughts about that.
Well, I think it's true. I mean, I think it is romanticizing, but I also think it's true. I mean, I spent a lot of time on college campuses, and one of the things that comes up time and time again is there anything that will come out of this? And I think what does come out of it actually is, once you are well, not when you're sick, but once you're well, is if you can take from that some increased notion of the human condition of suffering and pain and use it meaningfully, both in, if you're a creator or whatever, or to give back to other people, you know. And I think you see that a lot. I'm incredibly impressed by a lot of students who give back to other students in terms of compassion and time and effort and forming student groups and encouraging other students into getting help and so forth. So I think that it's both. I mean, I think that it's devastating. There's nothing good to be said for the devastation, but it is also true that it's as ever in life, it's what you do with it. You know, it's like if you've got high intelligence, if you don't do anything with it, you know, what's the point? If you get through pain and suffering and you are able to look at it and make something out of it, then great.
Isn't it also a symptom, a fairly classic symptom, that in this illness, that one finds any reason, any excuse to stay in it, whether it actually fuels your creativity or that it fuels the absence of whatever it is in your life? I mean, it's a way of perpetuating the illness. Isn't that part of the symptom?
Well, I think it's a cruel illness because the illness itself gives you the idea that this is what should be. You know, there's a study of psychiatrists, I'll speak from that perspective. When they ask psychiatrists in the middle of a depression what's wrong with them, none of them think they have depression because that would be a treatable medical illness. No, they're all, I'm a terrible person, I'm personality disordered, and I'm difficult. Because it's what feels authentic, how they're feeling. And so the idea of, you know, you have a fever enough days in a row, you go to the health center and say, I don't know why I have a fever, but it needs to go. This is so intensely personal that I think people do hold on to it or just think this is the new me or this is who I am. And it really gets in the way of people receiving the treatment they need. And
certainly with mania, which is powerfully addictive. Leaves cocaine in the dust, so that if people in the early stages, the 50% of people when they get manic who have euphoric, expansive, grandiose manias, it's very hard to convince people who are feeling better than they've ever felt in their life that they're sick. So, you know, trying to tell a 20-year-old who's just up all night, bubbling with ideas, feeling like full of energy and so forth, that somehow there's something wrong with them. Good luck with that. It tends to be the medical system or the legal system that intervenes.
Do you think that there's and this is difficult, when people say, well, culturally, my culture doesn't really acknowledge, I've not met the culture yet that acknowledges mood disorders and embraces them and says, oh, okay, that's a part of who we are. Do you think there's something different about the musical community, though? And we've talked a little bit about the creativity and everything else, but that there's more stigma or that the stigma's a little bit different? I guess I'm looking for insights in how we do a better job of fighting the stigma in this community.
I think somehow there's a grand, sort of romantic idea that this creativity, anything that would feel, that would make us feel like we're creating, anything that makes us feeling like we're more imaginative, we try to actually, put it in this really wonderful place, even if it's the illness, and if it's a lie of the illness sometimes, I think, that makes one think that this is such a wonderful thing. Keep in mind that when you have an illness, you've basically lost the ability to think, ability to feel, and ability to really have rational sort of, to make rational decisions. And you're in that state and you think that, this wonderful thing I must keep, well, that's not going to be very rational, and that's not going to fly.
Well, and it's so, I would imagine it's so critical to have mentors like yourself, like Dr. Jamison, people in your life who have had a lot of success say, you're going to be more successful. You said, there's a lot of playing the instrument, not really doing the work. I think we have a sense of what that is. You're putting in the hours, but you're not actually able to connect or be productive. And so I would imagine that for students, we can get their feelings about this, but having someone say, I think this is a good thing to do, and encouragement from their seniors must be very important, because otherwise I think there's really this block of, if you're tough enough or you're talented enough, you'll just get through it.
I think, there are instances, I like to go back a little bit about some of the experiences I've seen in students who may be having manic, episodes or mania. They are practicing and they can't focus on what they're supposed to work on, and they keep sort of getting different ideas of what needs to be worked on, and so they keep skipping and all kinds of things, and not able to actually focus to get the work done. So they have so many ideas, and they come up with so many different ideas of what needs to be corrected and what needs to be worked on, and yet they can't accomplish any particular one because they're just too busy going from one to the next.
The disorganization of it all.
Yeah.
Okay.
So
we had